The Ministry of Health is in the process of acquiring a machine that will test the viral load of HIV positive patients as Guyana works to achieve the UN-AIDS 95-95-95 by 2025 target. The target means 95% of HIV positive persons should know their status, 95% should be on treatment, and there must be 95% viral suppression rate by the year 2025. The machine to be purchased will aid in measuring the third target of the 95% viral load suppression.
So because of that and recognizing that's an issue and we would not be able to accurately monitor this third 95, the ministry has taken a decision to buy a viral load machine so that we can do those testing in country. Other than that, if somebody would require to know how well they're doing on their viral load, they would have to do that test privately. And it's a very costly test. So we have taken the decision that we're going to buy a viral load machine, and we had allocated monies this year to purchase that machine, and they're right now in the process of acquiring it.
However, Guyana is making progress with the other targets.
Guyana has done well on the first 95, and that is we have most of the people who are HIV positive know their status. So I think we are about 93% of those persons would know their status. In terms of treatment, we have a little bit more to go, especially during COVID, because while we had high numbers, during COVID we had a fallout for some people. They didn't come back to get treatment, and we are now trying to bring them back into the clinic. So there is room for improvement with the second 95, and that is putting people on treatment.
He explained that once a person has been diagnosed with HIV, regardless of that individual's CD4 count, medication is administered.
CD4 was an important parameter that was used in monitoring HIV patients because these cells, when you have HIV, these cells tend to be lower. However, in terms of treating patients, this is no longer that significant because at one time for you to go on treatment, your CD4 had to be less than 200, and they shifted that to make it 500 and so forth. So it was used as a parameter to put people on treatment. That's not what we are doing now, and for the longest while that's not what we've been doing. Once you have been diagnosed with HIV.
However, he noted that if an HIV positive person have not been taking their medication and is becoming sick or has other complications, then the doctor monitoring that patient may need to test for a CD4 count.